This is Sabina Shakya, who is currently working as a consultant at Single Stop. Sabina, can you give us a brief of your career so far and what your journey has been through education?
Sure. So I guess you can call me a public health professional. I've been working in the public health field for the last 4 or 5 years now. If you add in the internships, a little bit longer. But I started off college at Merrimack College in North Andover, Boston. And at the time, I still wasn't 100% sure what I wanted to do. I knew I was interested in the health field. I knew I didn't want to be a doctor. My older sister is actually a doctor, and I knew I didn't want that kind of life. But then I still thought that health is like an important factor and important aspect of everybody's life. And that's definitely an area that I can create a lot of impact. And so I started off just doing a bachelor's in health sciences. So I had a mixture of like hard sciences as well. So that included like, the regular biochemistry, physics, etc. But I also had the opportunity, being in a liberal arts school, to take a lot of other courses that you traditionally might not take if you just purely go on a science track. So specific courses that I really enjoyed were sociology, philosophy as well. And so that really piqued my interest in the social aspects of health. And so moving on to like second and third and fourth year, I decided to, within my major, concentrate in public health, which was actually fairly new at Merrimack at that time. But I found it really, really, really interesting. And I decided that, within health, public health is something I wanted to pursue. One of the key things that really struck me was like, there was a story that we learned in one of my classes where, you're at a river. I'm not sure if you've heard of this story, but you're at a river and then there's people at the bottom of the river, right? And so people are coming in and they're drowning. And so people are busy, like, helping the person who's drowning. And one by one, there's more and more people coming in, but they don't have time to look upstream. So that story really struck me. And so I was more interested in learning about the systems end of things. So looking at the public health system in general. And so with that, I graduated from Merrimack. I ended up doing another master's degree because I just felt like I didn't have enough experience to go on full-fledged in the workforce. That degree wasn't in public health, actually. It was around community engagement and community organizing. So I took a public health lens, but in a degree that wasn't really public health focused. So I learned a lot about how to approach like grassroots kind of change, right? Social justice was an important aspect of it, how to engage community members in affecting those change. So then after completing my 1-year fellowship master's program, I ended up doing an internship at an organization in New York called Global Health Corps. And Global Health Corps really focuses on building leadership skills for people who want to work in the global public health arena. And so we have fellows who worked in different states in the US as well, but also in 5 countries in Africa. And so that really piqued my interest also around not only like domestic public health, but international health as well. And I'm from Nepal, so I mean, I've always had that lens coming in as well, but I like just being here, I focused a little bit more on domestic health more recently. So after my internship, I ended up taking a program associate position at Single Stop, which is where I've been at for the last 4.5, 5 years now almost. And that organization, really, I'm in the healthcare department there, and we really focus on making sure low-income individuals have access to healthcare. So I do a lot of work around the program management, program administration for, right now, actually, there's 4. But it started off with 3 programs, government-funded programs. A lot of my work was on the administrative end, making sure that the program was running smoothly, etc. And so, and I really like that job. I really like what I do. I really like the different aspects of it. But then after that, I felt like I was lacking a little bit on like the public health, like education end of it. I've always been interested in it. I've done a bachelor's, but not a master's level. And so, after about 4 years, I want to say 4 years, I decided to go back to school. I wasn't ready for a PhD yet. So I decided to do a master's in public health at NYU. And so now I'm currently working part-time at Single Stop as a consultant, and I'm doing full-time studies at NYU. I just finished my first year and will be starting my second year in August.
That sounds great. So you really found what you'd like to do, and you'd like to serve the public, you'd like to aid people. So, what has been your experience so far studying at the NYU?
Yeah, actually, NYU has been great. My first university, the first college I went to was a smaller liberal arts college. Actually, not a lot of people know about it, but it was a good introduction, I guess, to the US for me. It was close to where I have a couple cousins in Massachusetts, so it was a good balance. Um, but having worked in New York and now enrolling at NYU is a much bigger university, and there is just a lot of opportunities and a lot of like things and activities going on. I'm actually really thoroughly enjoying it. It is a little bit difficult for me. I am working part time and I am doing full time studies. So it is a little bit challenging to balance all of that and still be able to explore all the different things that the school has to offer. But yeah, there's, I think, not just in terms of academia, there's just a lot of resources that are available at NYU for a variety of different people from all different like backgrounds. And um, if you're able to utilize and optimize on that, I think it's a great opportunity. And I think another plus is it's in New York, and so there's a lot of other things like just like the life in New York that's really exciting. Of course, now because of COVID, everything is remote, so unfortunately, a lot of people are not able to fully enjoy all of the things that NYU could potentially have offered. But the first year that I was there, that I am still part of, I guess. Has been really fulfilling for me.
Great. So, what skills do you think it takes to work at at a firm like Single Stop, which brings aid to people affected by COVID and people who are looking for jobs at this time?
Yeah. So as you know, with COVID, there's been a lot of ups and downs regarding like, unemployment has risen up and all of that. We, at least at Single Stop, I mean, everything is remote right now. So a lot of emphasis is given around skills that people can bring that allows you to optimize in a remote setting. So of course, that's going to involve a lot of digital skills, I guess, being able to work efficiently in a digital manner or using digital platforms. But in at Single Stop per se, though, I mean, the work that we do is very program focused. So we're not a digital, like, that's not our focus. Our goal is to connect people to services, right? And so the skills that we're still looking at are around like program management, program administration, partnership development, relationship development. The only difference now is how do you do that without being able to go and meet people in person and like be with clients in person, right? Which is what we traditionally were doing. So now it's like more transitioning into how to utilize existing tools to connect with people in a digital manner or remote manner. And that's a little bit difficult because a lot of the people, at least at Single Stop, are more of the low income, they fall under the low income category. Not, I mean, most people here have access to smartphones and stuff like that, but we have a program that works with the elderly population, right? Those who are 65 and above, those are certified disabled and blind. So for those individuals, if you don't have family members to help you out, it's still very difficult to connect to them. So there are those challenges. But in terms of skill sets, if you're asking for a Single Stop particularly, we're still looking around like program management, program administration,
Okay. So,
training, whatnot.
thank
Sorry.
you, Sabina. Yeah,
Yeah.
sure. Thank you, Sabina. Thank you so much for your time. Good luck
Yeah.
on your work.
Thank you.